This patient came in with a history of a trauma on tooth number 9. The tooth gradually turned dark, and the trauma was done about 10 years ago, and endodontic treatment was performed. And she developed a nodule right above the root of the tooth, and she started developing a little swelling. So we did limited field of view 3D CBCT. You can see how large this lesion is, and it is pretty involved in the bone here. So we're looking around for a fracture. We didn't see a fracture, which is great on this case. We took a sagittal slice here. So you can see on the sagittal slice, you can see the lesion. You can see the lesion here, and you can see where the canal was under instrumented and under filled here. So this probably was a single cone case of thermofill of some sort. So this is a large lesion here, and we have a case like this. My question to you, would you do this in 1 visit or 2 visits? So what we decided to do a 1 visit retreatment on this case, even though their lesion is very large. And this is our cone fit here, and we obturated with bioceramic sealer and single cone condensation technique. We can see there's no bioceramic sealer in the lesion. You usually like to have some out. And this is the result of the internal bleaching. Looks really nice. We brought the patient back in 6 months. Look at this amazing healing. This is amazing healing without any bioceramic sealer into the lesion. And normally I would like to see a little bioceramic sealer in the lesion, because I always say I believe a little bit out there is like fertilizer to the bone. But without any bioceramic sealer, we have tremendous healing. The cortical bone is returning. There are no gaps in the root canal filling material. The tooth was restored, and it looked very nice. So you can see that this bone is healing up very well. And some of the studies show that this can take up to 2 to 3 more years for the bone to completely fill in and have osseous healing. So this is before and after of internal bleaching. And this is the completion after 6 months, and with amazing healing without any bioceramic sealer out into the lesion. And I talk more about this in my textbook, Endodontic Keys and Cases, that's now available on Amazon.